NBC News senior medical correspondent Dr. John Torres is here to talk more about vaccines and treatments. Dr. John, we got a lot to get into today. Let's start with the good news. We now have 3 vaccines with pretty promising results. AstraZeneca saying today its vaccine is on average 70% effective, but 90% effective when it's administered a certain way. Can you explain that?
And Allison, I can see how this can get confusing. And this is kind of the science behind the actual vaccines. And like you said, there are 3 different vaccines right now that are front runners. And Tom Costello was mentioning the 4th one, the Johnson & Johnson, probably the beginning of next year. But with this AstraZeneca Oxford vaccine, what they're saying is when they gave people their 2 shots, and it's a 2-shot series, and both shots were at full dosing, then they saw around 62% efficacy. In other words, it protected about 62% of the people from not getting COVID. But then when they went and they only gave people a half dose initially and then a full dose the second time, that efficacy bumped up to 90%. And that's causing a bit of head scratching because a lot of researchers are saying, that doesn't make sense. Let's take a further look at the data to find out why exactly that's happening. Well, they combined that 62 and 90% and said it looks like it's around 70% effective overall, but they still have a ways to go. They still need to find out why exactly that's happening. But like Tom mentioned, the other ones, the Pfizer, the Moderna, are showing 95% efficacy. These numbers are a lot higher than we thought they would be. That's great news, Allison.
Dr. John, we've heard a lot about the temperature that these vaccines need to be stored at. The AstraZeneca vaccine doesn't require that ultra cold storage that the Pfizer vaccine needs. How big of a deal is that?
That's actually a very huge deal, Allison, and that's one of the reasons that a lot of people are excited, because even though that efficacy isn't as high as some of the other vaccines, that storage is extremely important because this is a global problem we're having right now. And so getting that vaccine to remote areas, especially areas in developing countries that might not have electricity, might not have even refrigeration, it's going to be much easier to do with this type of vaccine. Plus, it's a less expensive vaccine, so governments are going to be able to afford it to get it to their people. And since we are a small world, if it can't get to every corner of the world, that pandemic is not going to be under control. So this is a very, very big step forward. The Moderna vaccine also can use normal temperatures as well. It's the Pfizer vaccine that needs that ultra cold storage, which gives some logistical issues and some logistical problems going forward, but certainly vaccines that can be used here in the U.S. very well.
Dr. John, what do we know about how effective these vaccines will be in eliminating COVID-19? Will this be like the flu where people still get a vaccine every year, or are we looking at something like the polio vaccine where COVID would eventually be eradicated, or do we still not know yet?
And Allison, we don't completely know what's going on, but it looks like this vaccine is going to give us at least a few years protection and maybe hopefully even more. And so I think we're talking about the middle of the road from the 2 scenarios you're talking about. But the one thing about the vaccine, you could have the best vaccine in the world that could give you lifetime protection, but if people don't get the vaccine, it's not going to do any good. So we need that herd immunity. That 70+% of people need to be vaccinated against the virus in order to make sure we get this pandemic under control. And that's the big milestone they're going to have to hit. That's the big hurdle they're going to have to get over to get enough people vaccinated to get the pandemic under control as soon as possible, Allison.
Dr. John, on the treatment front, Eli Lilly's COVID treatment is already being distributed to hospitals. Regeneron's treatment got emergency use authorization this weekend. Could you tell us about these treatments, when they'll be used, how effective they are?
And these are 2 different treatments, and they're used essentially 2 different ways. So Regeneron's treatment is what Tom was talking about. It's that antibody, that monoclonal antibody cocktail. So what they did is they got antibodies from somebody who survived COVID-19, have antibodies. They took them to the lab, and they basically made more of them in the lab. They took 2 different types, and they combined them together. And this is the one the president got when he was hospitalized for his COVID. And so this one helps keep people out of the intensive care unit, helps keep people from being hospitalized if they can get it early enough. But it's one that needs to be used early. The other one is the baricitinib, which is an anti-inflammatory medication that they use along with remdesivir. Using that combination can help people, if they're on oxygen, stop them from having to get more complications from coronavirus. And so these are 2 different medicines used in 2 different ways at 2 different stages in the process. They have to be very specific about when they use these, but we're finding out with the vaccines, with these treatments, with an understanding of how to treat overall coronavirus, we're having higher survival rates. We're doing much better than we were just a few months ago. So that's fantastic news, Allison.
Dr. John, we have to talk about Thanksgiving. The CDC warning, cancel your plans, don't travel. But millions of people are not listening already. The TSA says it screened more than 3 million people at U.S. airports in the last 3 days. Are we in trouble here? Is there any way to prevent this pandemic from getting worse if people simply will not stay home?
And I think if most public health experts are honest with themselves, they'll know that this was going to happen, that even though the message has been out there not to travel, that the traveling is going to happen. And so it's a matter of what I tell people all the time. If you go to another house, you're not going to be safe, but there are ways to make it safer. And number one, the one thing you want to make sure is there are no high-risk individuals at that house, because if they're high risk, meaning they're elderly or they have pre-existing conditions, that could put them at a higher risk of complications from coronavirus, not something you want to have happen. Also, make sure you wear masks unless you're eating or drinking. Make sure you socially distance. And then simple tips like ventilate, open windows to get that air flowing through. The CDC actually came out with some information saying, who can you consider a household member? Because a lot of people were saying, well, my college student coming back, are they household members? They said, it depends, because if they've been living under your roof for the past couple of weeks, physically under your roof, then you can consider them household members. If not, as in somebody returning from college, you can't consider them household members. You need to make sure everybody wears masks and socially distances. And I know that's going to be hard to do, but we just need to get through this one. We're already seeing high numbers of cases. We don't want to see numbers go even higher, which unfortunately I think is going to happen, Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.